Eisenmenger syndrome. Instruction by the examiner: examine the CVS, examine the precordium, or palpate and auscultate the precordium. Presentation of a case: pulse 104 beat per minute, low volume pulse, JVP raised with prominent airway, blood pressure 110/70 mm mercury. On precordium examination, on inspection, visible cardiac impulse in pulmonary area. On palpation, apex beat in the left intercostal space, centimeter from mid-sternal line, normal in character. There is left parasternal lift, palpable P2 and epigastric pulsation. On auscultation, first heart sound normal in all the areas, second heart sound louder in all the areas, P2 is accentuated in pulmonary area. No pensystolic murmur, it disappears. Lung fields are clear. So my diagnosis is Eisenmenger syndrome due to VSD. What are your differential diagnoses? CCF, chronic or pulmonary. Why not CCF? In CCF, triad of engorged and pulsatile neck vein, enlarged tender liver, and dependent edema should be present, usually secondary to other causes like mitral stenosis or left-sided heart failure, which are absent in this case. Why not chronic or pulmonary? Pulmonary is defined as right ventricular hypertrophy or enlargement with or without failure, which may be due to causes in the lungs, parenchyma, pulmonary vessels, or chest wall, like kyphosis, scoliosis. All of these are absent in this case. What investigations do you suggest in this case? X-ray chest shows enlargement of central pulmonary arteries with peripheral pruning of pulmonary vessels. ECG may be right ventricular hypertrophy, right atrial hypertrophy, right axis deviation. Echocardiography, cardiac catheterization in some cases. Now, what is Eisenmenger syndrome? What are the causes? Pulmonary hypertension with reversal of shunt is called Eisenmenger syndrome. Causes are VSD, ASD, patent ductus arteriosus. What is Eisenmenger's complex? Pulmonary hypertension with reversal of shunt when due to VSD is called Eisenmenger's complex. What is the difference between Eisenmenger syndrome and Eisenmenger's complex? Pulmonary hypertension or with reversal of shunt due to any cause is called Eisenmenger syndrome. But when due to VSD, it is called Eisenmenger's complex. Now, what are the clinical features of Eisenmenger syndrome? Symptoms are dyspnea, fatigue, syncope, angina, hemoptysis, features of congestive cardiac failure. On examination, central cyanosis not corrected by giving 100% oxygen. There may be differential cyanosis, means cyanosis in toes, not in the hand. It is found in patent ductus arteriosus. Clubbing is present. There may be differential clubbing, means clubbing in toes, not in the hand. It is found in patent ductus arteriosus. Pulse is low volume, prominent airway in JVP. Other signs of pulmonary hypertension: palpable P2, left parasternal lift, epigastric pulsation due to right ventricular hypertrophy, loud P2. Ejection click and ejection systolic murmur may be present. PR may occur. In such case, prominent V wave in JVP. Also pensystolic murmur in left lower parasternal area. Polycythemia, original murmur of VSD, ASD or PDA, decreases in intensity, even may disappear. In a patient with central cyanosis, clubbing with signs of pulmonary hypertension, likely diagnosis is Eisenmenger syndrome. What are the complications in Eisenmenger syndrome? The complications are right heart failure, thrombosis, polycythemia, pulmonary embolism and infarction, infective endocarditis, cerebral thrombosis or abscess, dysrhythmia, sudden death. Now, how to treat? Diuretic, digoxin may be given in some cases. Venesection may be required, especially if polycythemia. Long-term intravenous epoprostenol may be tried. Heart-lung transplantation may be done. Mortality rate is very high than heart transplantation alone. Surgery is contraindicated in Eisenmenger syndrome as it aggravates right-sided heart failure. What is the effect of pregnancy in Eisenmenger syndrome? Pregnancy should be avoided. It aggravates right-sided heart failure. Also may be early spontaneous abortion. Mortality rate is high in mother. What happens of murmur in Eisenmenger syndrome due to VSD, ASD or PDA? Due to reversal of shunt with pulmonary hypertension in VSD, there is equalization of pressure between left and right ventricles, so the murmur disappears. In ASD, both MDM and ejection systolic murmur disappear. In PDA, maybe only soft systolic later on disappears.